Alright, guys, so I've made it through almost the first 24 hours, just under that. Uh, Now that I'm a lot more coherent than I was yesterday after surgery, I figured I would sort of give a bit of a recap and then go over some of the details of what this whole thing is. So yesterday I got to the surgery center at around quarter after 7. I was supposed to have an 8:15 procedure, but my surgeon had some complications with his first patient of the day, so I didn't go back till probably 9:30, quarter to 10. I was incredibly stressed out because in the past, when I've had similar procedures where they need you to be awake enough to tell them that you feel something, but they will sedate you enough so that you're comfortable. I haven't been comfortable. I've hurt. Uh, One time they hit a wrong nerve and I literally blacked out from the pain. And so I made sure to repeat over and over, like, please make sure that, I'm not going to be hurting. And I had one of the surgical nurses, she took my hand, she says, I promise that it's going to be different. Like, you're going to be okay. Unfortunately, it was not different. We got back there. They had me roll on my stomach, which was a little difficult because it does not feel too good on my back. But anyway, so they had me get on my stomach and then started putting in some of the sedative medication into the IV. They asked me if I felt anything, and I said, really, no. And they kept giving me more and more, and still wasn't doing it for me. Um, but nonetheless, they started the procedure, and that was just absolutely horrendous. The first sort of peen was him using, I guess, whatever they put in there to numb your leg up, to numb, like, local anesthetic to numb up the area that burned so bad. And then when it came time to put in the leads, like, by that point I was like pleading. I was like, please, like, give me more, because I was at the point of like screaming in pain. And so the doctor, who's also an anesthesiologist, he said, you got to give her some more. And so, but nonetheless, it still didn't help. And so he had to use these sort of like large, long, hollowed out needles to put the the leads into the back of my leg. Um, each of these wires um, goes to one of those leads, and then it goes across and is touching the nerve, supposedly to help. I was incredibly responsive to when they turned up the amplitude, or whatever you call it, of each of the leads, so that they knew that they'd hit the right nerve. And so once that part was over, I sort of, I guess, gave up, and because I don't remember getting wheeled into post op. I think I was just so physically and mentally drained that I just, I was done. So in post op, they sort of really, really rushed it. I was still pretty out of it, as you saw in the last video, when they had me leave. Um, didn't do the whole typical you gotta eat or drink something sort of deal, because they needed my bed. Because of COVID, they need like 6 feet apart from each bay, and so each bay is now the size of two instead of one. And so one person equals 2 bays. And so they were very happy to get me dressed and get me into the car. Unfortunately, my mom couldn't be with me at all during this whole thing because no one was allowed. And so they called her on her cell phone. She pulled up to the front entrance and they loaded me into the car. And once we got in the car, I was still very uncomfortable, but um, made our way home. A good friend came, helped to get me into the house and settled. Was able to eat some lunch, and then the day was just rough. Um, I just got a phone call from the surgery center because they were like, what was your pain before and what was your pain after? And I'd say going into it, it was like a 3. And right now, like my entire upper leg is like a 6. And that's being generous. And seeing I have CRPS, I know what pain is. Um, and yesterday and last night, it felt like one bad flare because my whole leg going into my foot felt like it was on fire and it was stabbing and it was just so painful. Still, it really hurts to stand up. Any straightening out of the leg is very difficult. I know they don't want you to really, really stretch or really, really exert yourself at all because apparently it takes a good 7 days for these leads to scar in place and they don't want them to move. So, but yeah, so I'm here this morning. My mom is off at work for a few hours, so I am having my delicious hot chocolate with Miralax in it because I'm needing more pain meds, and so gotta make sure I don't get bound up. So on the next part, I'll be going through basically the sections of this and sort of what you do. I do have also my controller. I'll give a little comparison between this controller and my spinal cord simulator controller. This thing is really tiny and I got a sweet little lanyard. So yeah, so I'm gonna put some pictures up and just explain what everything is. So stay tuned. Right, everyone. So let's go over this setup. As you see, there's lots of parts, and they give you a box with lots of extra parts to switch out. This device you see right here, that's sort of the brains. On the right where it says INT Extensa, that is like the unit, the main thing that is telling your leg, work. And then the piece that I detached that says SPR, that's the battery. You're going to need to change it out every day because it does not have a long life. But they give you a charger with an extra battery, so you just switch it out every morning. And to switch it out, you literally push in on those sidebars to pull it out, and then put the new one in, and it turns green. And then you have, these are called mounting pads. That's how the plastic thing with the brains is attached to your leg. You're going to need to change these every single day as well. And what you do is you first snap the device onto those two metal pieces, and then you just pull off the tape and it secures to your leg. And then finally, as you see those, there were wires, and these are the sort of docking station for the leads to hold them in place. And then finally, we have the remote. It's really simple. It has a lock and unlock button, a home button, and then an up and down for each of the two leads. And then finally, this is just a comparison of my Boston Scientific Wave Rider remote and this Sprint remote. You can see it's a lot smaller. Alright guys, so that sort of wraps it up. I will do a bit more of a detailed demonstration, I guess, of how to use the remote. And I'll also, if you have any questions, feel free to drop them in the comments section. And I have like this booklet annual thing here, so I could sort of answer just about anything. But I'm hurting pretty bad, and so it is time to just, unfortunately, sort of waste a day away again and get some sleep in. I am gonna call a doctor because this pain's pretty intense, and I just want to make sure that I'm supposed to be feeling this way. So I'll give you an update tomorrow. Hope you're all doing well, and I will catch you guys tomorrow.